Hi, my name is Chris. I'm doing my second lab pass off because Melissa actually said that he had a burning and sensation pain, and I actually said he was alright, so I'm going to do this to make sure that we do it correctly. And we're just going to be getting the urinary specimen. Alright, I have my antiseptic wipes, alcohol, my syringe, my specimen, and then right here just to make sure that they're clean, and then this to provide cover. Alright, so I'm going to go and I'm going to knock. Wash my hands at the nursing station, then I'm going to knock. Hi, my name is Chris. I'm going to be your student nurse for the day. I'm going to write my name on the whiteboard. I'm going to ask him for their name and date of birth. And I'm going to check it on the two identifiers on the wristband, make sure it's fine, and look for allergies as well, just to make sure. Alright, well that's great. I'm going to raise the bed to a comfortable height. I'm going to make sure the side rails are up and the bedwells are locked. I'm going to provide privacy. I'm going to then do hand hygiene, put on a clean pair of gloves, and I'm going to say, alright, so you've been having some burning and sensation pain when you've been voiding? He says, yes. He says, which is bad because that's a sign of a UTI. We put a catheter in him 2 days ago, and so we're basically assessing for that. All right. Can you describe that pain? Can you tell me the characteristics? He says it's a burning sensation. It's painful. He gives me the onset, which was just a few hours ago. The location, which is basically his urethra down his penis. Maybe you feel some in his testicles. All right. The duration is just when he voids. It exacerbates, basically voiding exacerbates the pain. It goes from about a low pain to a high pain once he begins urinating and then ends urinating. And he scored it at about a 6 out of 10 at the highest. How does it radiate? It radiates. It basically just stays right there. He says once he voids, and what relieves the pain? He said he just basically just doesn't think about it and uses Tylenol. And he gave me a score which is 6 out of 10. All right, we provided cover and all that. Awesome. All right, well now I wash my hands, I put on gloves, and I'm gonna clean him just to make sure that everything's okay. And I'm gonna clean basically with this using a wet washcloth from tip to base. And I'm gonna use a different part of the cloth every time I stroke. And then I'm gonna also pull away the foreskin as well and incorporate that as well and clean the scrotum. And then I'm gonna get a dry cloth, I'm gonna dry it. And the scrotum always tip to base, and then I'm going to replace it. And then I'm going to take off these gloves, wash my hands, put on a new pair of gloves. And once I put on the new pair of gloves, essentially I've done my assessment. I know that he's hurting. I've done Colders, and I basically just want to make sure that he's doing okay and everything. I might do an LOC, levels of consciousness, basically to make sure there's no confusion. He passed all the tests. He knows who he is. He knows the place, and he knows the situation that he's in. Awesome. So I have my specimen cup here with my new clean pair of gloves. I'm going to wipe right here. You might want to get close for this. All right, I'm going to wipe right here. Awesome. Now that's clean. I'm going to go lock this in. You might want to get close for this one too. So it's locked. And, well, I have to actually kink the tube before I pull any urine. So this is all right because I didn't pull any urine. I cleaned that, and we're gonna have to kink the tube to make sure that the urine basically stays right there. We might have to wait 5 to 15 minutes, maybe even longer, but we want to make sure that our goal is to get at least 30 milliliters, but hopefully we can get as much as possible. And yeah, so we're gonna make a good attempt right now. And here we go. All right, we've waited about the right amount of time. I've kinked it. Just for purpose's sake, I guess I'll wash it again, clean it again. All right, thank you. And then with the syringe. All right, I'm then gonna pull it out. And I'm gonna pull it as much as I can. I would use probably a bigger syringe for this, but this is just what I had on me. And great, so we're gonna say we got it full. We got it full. We got 10 milliliters of urine. And then I'm gonna open this. Put it in, careful not to touch any of the content inside because this is a sterile thing. Then do this without spilling any of the contents. All right. Throw this away because that's no longer sterile. And then I'm going to get this and I'm going to wipe it again with alcohol just to make sure that it's all clean. All right. And now I've got my specimen. I have to put this to the lab about 5 to 15 minutes because if it goes, in 5 to 10 minutes. If it goes 15 minutes, I have to at least put it on ice before then because then it will chemically change and the lab test will no longer be good. All right. But now I'm collecting my specimen. I need to make sure it has the patient's first name, last name, the physician's name, their physician's name, my initials, the date and time I collected it, and what purpose this lab test is for. Alright, so now I have all that, and I need to make sure I get it to the lab soon. But I'm going to do my ending procedures. Make sure that they're covered. Make sure they have their call light right here. Make sure the bed is to the lowest setting, that the bed wheels are locked, and that the side rails are all up. I'm going to take off my gloves, wash my hands, make sure they're okay, make sure they have the overbed with their call light and everything else they need. Fantastic. So he says that he's doing okay. He says he still feels the pain. I'm going to tell him, well, we're going to make sure we're going to check on that because we want to show that we care, especially since a UTI can be very difficult to go through. And I want to gather my equipment. His call light, his water, his overbed, the beds, lowest position, locked, side rails up, call light, I've washed my hands. He's positioned in a position that he likes. Oh, I need to make sure I put on another pair of gloves, and I would unkink this tube because we can't leave the tube kinked. And I would make sure that everything else is fine down there. So now the tube's unkinked, and then now the bed's to the lowest position, everything's fine. Take off our gloves, wash our hands. We can then make sure he's adequately covered, remove privacy, and then we're going to document. I also have to document how much I took out. And so we took out 10 milliliters because he's on I&O. So we have to take out 10 milliliters of output. I need to make sure I have it properly labeled, which I did specify. Patient's first and last name, physician's name, my initials, the date and time I collected, and what the test is for. And yeah, and so we did that, and I basically make sure I get to the lab on time before 10 minutes. And if not, then I'll put on ice. And yeah, and I basically make sure that he's okay. See if he has any questions for me. I leave the room, remove privacy, and document. And we're done. We did it.